Hi everyone. Hello, hello. Thank you for
Hello.
joining. I can see you.
I Damn, there's already three other people in the live session. I feel like a rock star.
Literally.
Six? Damn.
I can see like 7 people now. Yay, hi
Oh
everyone.
wow. Oh no, one person just left. Did not expect this.
Okay, everyone. So this is Dr. Sohan Kabir. I'm not used to calling you Dr. Sohan Kabir. I'm usually like I just
Yeah,
call
you
you
just
Sohan Bhai.
just just say Sohan Bhaiya. That would be good, please. Every time somebody adds one of those titles, I feel a bit older. So just Sohan Bhaiya is fine.
Okay. So um I don't even think I know exactly what you're doing. I just know that you're in
Yeah,
Australia and I don't even remember the city that you're in. So just tell us a little
yeah.
bit about where you are and what a specialty you were studying. Now you're working.
Right. Yeah. So I am currently in Melbourne, in Australia, and I completed a master in public health from Deakin University. So that's the happen. That's what I was doing this whole time after I left China.
Oh,
So
I knew it was public
yeah,
health and I knew it was
yeah, it
different.
was public health. Yeah, yeah. So that I've been doing. I think one of my public health classmate joined, Paul. He
Oh,
joined the
cool.
session too. So, oh, and he might have left. No. So yeah. So basically, I'm in Melbourne, the center of Australian culture. Yeah. So it's a pretty good place to be, especially if you want to get into public health, because you will get a lot of opportunity post-COVID. I must warn everyone that whatever information I'm about to share with you guys has a lot to do with the COVID situation.
Okay.
So yeah, hopefully you will put that up as a disclaimer.
Okay. So, for people that don't understand what exactly public health is, and especially because public health is very different than clinical, and what exactly I mean by public health being a non-clinical specialty, could you explain what exactly it is?
Right. So, what to be very honest, you can apply public health in a clinical setting. I'll come to that too. So, to be very honest, public health itself is a very broad subject. So, you can divide it into about four or five parts, depending on which area you want to specialize eventually. So you will have your core units and then you'll have your elective units. And the elective units can help you decide which area you would like to work on. The most common is either you work as a health promotion officer or you work in health promotion, or you work as a policymaker, which is the public health practice. So let's say vaccinations. If you want to provide vaccinations, who are you going to provide to? The age requirements. Because you see, in case you were not aware of it, Australia was pretty late with the vaccination because the vaccinations initially was only available to people above 60. So all these policies that are made, why are they making it? And then you eventually take it to the government and you basically become the middleman.
Mm-hmm.
That is the most non-clinical version of public health practice.
I think this
And
policy making part of public health is the only part that I was personally aware of. And I thought public health is
mhm,
like a specialty where you can only work for like big organizations like WHO, UNICEF, or the government directly.
yeah, right. So if you want to hold on to your clinical expertise, and if you want to add your public health knowledge to that, it does become very useful. Let's say if you want to be a doctor who wants to work with Doctor Without Borders, or if you want to work for Red Cross, if you're a doctor with public health knowledge or with a qualification in public health, you will definitely have a higher chance. because you can work as a doctor plus you can work as somebody in health promotion, which is another very big thing, the health promotion. So I remember our professor on one of our classes, they straight told us that you're a salesman. You know, when you're a public health practitioner, if you want to go to the health promotion side, you become a salesperson. You basically go and sell people ideas that, this is good for you.
Mm.
And you know how it's difficult it is to make people accept. So that's the other side of public health, the health promotion. And another thing that is something that most people choose when they come into public health, especially if they're from a non-clinical background or a clinical background, which is the research side, an epidemiologist. So
Oh.
you collect data, you create questionnaires. So to believe it or not, like for a doctor who studied medicine for 6 years, it was a nightmare because I had to do a qualitative and a quantitative research paper
Yeah,
because
I think we studied
and
that
that
in
was
one
not even
class.
among. Yeah, I mean,
And it was
no,
like,
we actually had to.
I like
No, because
now.
biostatistics was a lie for us. What biostatistics did we learn?
That's
I
what I'm
I I
saying.
had to code.
I'm
I
pretty
had to
sure it was
code
a
a paper.
bias.
Yeah, no, I mean, this is really bad advice, especially for like future perspective young generation. But I survived biostatistics because one of my closest friends here when I came was in IT. He
Oh.
helped me figure it out. You have to use Strata. Strata is basically a data input device where you put the math problems. I had to do math. I became a doctor to avoid math problems, and I actually had to do that. And it was a very very, how would I say it? See, Paul is laughing because Paul knows about it. So it's and I was horrible. Like I mean, especially Paul. Paul is also a doctor, by the way. Paul's a doctor. I have another close friend of mine, Abdul. He's a doctor. So for anybody who studied medicine, public health was a challenge because we had to rewrite our idea about a lot of things. And yeah, and the other thing that a lot of people can do is, so I think I've already mentioned it, the clinical side, which is uh, why I personally chose public health. What was my initial intention is that if you have a public health degree and you have a medical degree and you have the aforementioned license of that country, it is much easier for you to work in a non-government organization. Because you know that I think a lot of the people that know me know that I like to travel, so I kind of
Yes.
wanted to be that traveling doctor kind of a thing. It's gonna take time though. If you take that route, it's gonna take time. Currently, I'm actually doing a volunteering work with some people. A friend hooked me up with it and gave me the idea of it, and it's a WHO online thing where you help people around the world. It's just a completely online thing, but you have to do a lot of volunteering work to get there.
So if
But if you
I,
want to,
yeah, so if I was to
please.
apply to this clinical part, are there like different modules or different units to it that you choose? And when you choose them, do you have to give like an Australian, like since you are studying in Australia, if you were to choose a clinical side of this, would you have to give the exam before you got into university, or like that's like a
Oh no, 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 no. That doesn't matter. To be very honest, the public health part is not directly linked to it. It will help you. It will
hmm.
help you do the clinical side. There are no certain requirements to complete the public health degree that might help you with it, but the licensing, personally, from being here, I personally suggest that if anybody wants to come here, um, personally, I suggest either you decide that you want to do research or you try to give the exam before you come here, or when you finish your public health, right after that try to finish the licensing exam, because the public health degree will enhance your medical career if you want to go to certain as a with an NGO, let's say with Red Cross or WHO. But it's not like oh, you have to complete certain subjects in the public health degree to go and do that. You
So
can
the,
just
the
do
clinical side
whatever
thing
you're
would
doing.
be, yeah, up to you. Like you can give the
It's up to you. Yeah. Hmm.
so my next question is like, when you were studying, what exactly was your day like? Like, what were, how was your day in Deakin University?
um, well,
I can never
well,
say the name of your university like with a straight face. I'm sorry. I'm not
with
like
Deacon, it's completely fine. Deacon, you have to make sure you have to make that pull
pronounce
with the
like
E
you
and
have to
the A.
enunciate
Yeah,
each word.
you have to enunciate the E can. So yeah, um, well, it depends though. I guess it's very difficult from a medical university because if people over here are mostly doctors, then you would know that medical university is a completely different thing. We have our own thing. Everything is just medical university. Plus, you have the fact that we were in CCMU. So I think 2012 batch onwards, we got directly into the international dome. We were low-key segregated. Uh, in that case, it was a completely different thing because now I was in a university that had multiple subjects. So it was like a completely different environment.
Mm-hmm.
Um, so they would start for me honestly because I was also trying to study for the licensing exam in Australia. Trying to look put that in like bright red letters. I was trying to. So the day would usually start depending on what classes would be on that day. And although it is sometimes possible to skip classes because you have this whole 75% thing going on, it's not a good idea, especially when they're so the classes would be divided into a lecture or it would be a seminar. Seminars are very one-to-one. You can communicate with the teachers, so never miss a seminar. So it would depend on the time of the day. 2 hours before that would be the day, and because of my CCMU laziness, yeah, sorry. You seem to have cut off for a while. So I was living right next to the uni, so I just walk, grab a coffee from the cafeteria because in Melbourne, coffee culture is large, and then just go to a class. You know, and meet some of the friends who used to live a bit far away, communicate with the teacher. After that, grab lunch. Um, Sometimes when we had group projects, those would be really fun days because you after that you either go back to the dorms or someone's house or you go to the library, and then you just sit and then you figure things out, try to study,
You
give
were also
up,
working.
cry. And yeah, of course, and then there's the part-time work, which is something that a lot of people would enjoy here to the degree that you can earn money. Because for students, for us who were studying in China, we really didn't have that big of an opportunity to work freely to what we wanted to do. So you can do that. So you have to balance that, and you have to go out, right? You have to socialize because you're meeting so many people.
Mhm.
Because if you don't socialize and you just focus on your studies, then you're gonna your head's gonna explode.
What about people?
Especially for people.
What about people that
Yeah.
started working? Since you also started working, sort of volunteer work, and you work.
Mhm.
So how is your schedule, or how is a typical schedule of somebody that would be in public health?
If you are working full time, which I'm not doing, I'll be very honest, because it takes a bit of the course I
Mm-hmm.
want to take, the route I want to take, and with the whole COVID situation and the fact that Melbourne is a very demandable place. But if you do get that, Australia does have a whole limit. I think you have to work. You cannot work more than 48 hours or so, something like that. You'll get your weekends off. You will have paid leaves. So it would be a typical 9 to 5 job. But at the same time, from what I can see when I was studying and from what I can see with the little volunteering I'm doing right now, is that there's a lot of work to bring home.
Okay.
You will have to bring home a lot of work. Yeah, I mean, it's a how do I say? It's a bit difficult. So there are three work routes that can go on. You can either work permanent, a full time, or you can work part time, or you can work casual. So if you want to work in public health, you'll be either working part time or full time. Nothing casual.
Okay. What's casual work though? This is like the first time
So
I'm hearing.
casual work, so
What is
casual is
that?
exactly what it sounds like. So casual work basically you tell them your available dates,
Oh,
and they will give you a call being like, hey, do you want to work at this time? And you'll be like, okay, cool. So no contract.
very
When you
catchy.
go part-time, yeah, it's a pretty good one. You can leave whenever you want. And with the full-time one and part-time, you have a contract and you have to work those specific days.
So
You know,
why?
so some students prefer.
Mm.
Hmm.
Why exactly did you decide to choose public health rather than go for like something more? Now, I don't know why I'm calling like I think whenever you study in med school, clinical would be like a mainstream thing you choose. Like, okay, I'm doing
Yeah,
it and
yeah,
go.
mainstream. Yeah.
Why did you decide to
So
go this route? This route?
yeah. So my personal dream, I told you that it was to
Mm.
work as a doctor, as a GP. I don't have to get into something. I do want to be a pediatrician if I ever get the opportunity, but I wanted to be a GP who works for health organizations.
Mm.
That was my main reason. So
I've also seen some people take up like non-clinical specialties, especially in countries like Australia and UK, just to have like a visa and have a feel of the place for 1 year. So they are studying for, like you said, they're trying for AMC or they're trying for PLAB, and
mhm,
simultaneously they are getting their non-clinical degree.
mhm,
And since they already are in the country, they have a feel of how the healthcare system works there, and they just get used to
right.
the place. So this is like a
Yeah,
strategy. One of my education consultants told me that, oh, you can just do this.
yeah. And good thing that you picked it up. Please, guys, don't do it. Don't do it. It sounds like, oh yeah, we're here. If you take that route, what will happen is that, yeah, once you enter a country, you'll find 50 shades of gray of staying here. You'll always find a way to figure something out. That is not the life you want to take. We studied medicine. By the time we finished medicine, other people finished their bachelors, their masters, got married, had kids. Uh, so yeah, legit. And
Yeah.
you don't want to take this route. I mean, I'll be very honest with you about something. So not recently, 2019, because 2020 didn't exist. So recently, when pre-COVID, my mom and dad came up, and I went to see a friend of my dad. So they studied medicine together. So the husband and the wife, they're both doctors. The wife passed AMC, I think, 15 years ago.
Okay.
My dad's friend, the husband, passed AMC 2 years back.
Oh, really?
2 years back. Yeah, do you understand?
Yeah.
So if you come here to study public health, trust me, take that route to only study public health or health promotion.
Mm.
Trust from a person who has been here, who has seen this. If you want to come and work as a doctor,
Mm.
work with your degree. Find a job as a doctor, work as a doctor, and give AMC at the same time. What will happen then is that you will have your qualifications or the license to work in Australia, plus you will have your work. What's that word? You'll have your work experience.
Yeah. So
If you want to become a permanent resident here, if you want that PR option, you need work experience
you'll have that.
without any doubt.
Yeah.
A year or two. A year or two, easy.
So
Now, if you want to do the licensing,
when I heard about this option, my
yeah,
first thought was, why would I invest so much money in a non-clinical course if that is not the route that I
yes,
want to take personally? And
it's $70,000. 70,000, and the AMC exam can amount up to 20 more thousand,
yeah,
and
that's
then you
like,
have the IELTS, right? Yeah. So, don't do public health, specifically public health, unless or until you want to go to research,
mm,
you want to go to health promotion, uh, and you want to either be a doctor for an organization or you want to be health administration. Now, if you want to be health administration, Australia is not going to be a good option for you because they're going to take very experienced people. If you're a fresh graduate, they're not going to take you.
but
Okay?
then
If you want to be a doctor, yeah?
can you graduate in like policy from Australia and then go back and work in,
Yeah, definitely. That's what they
honest.
encourage, to be very honest.
Oh,
Yeah, you're going to be well equipped. You're going to be very, very well equipped. And you can also have good opportunities in other parts of Australia, which is not uh, that habitat yet. Like if you
oh,
can go to Western Australia, you can go to the Northern Territories, you will have more opportunities there. If you are in the cities, in the major cities, Melbourne, and if you Melbourne, Sydney, or even let's say Perth, for the health sector, they're looking for very experienced people. So let's say
and
my dad applied right now, my dad would get a PR.
oh, because he's
It's kind of like that.
experienced.
Very experienced, because they're
Yeah.
looking for very experienced people. The only if you take the public health route and you want to find a job immediately,
Mm.
it's research, because they need a lot of research assistance. So if you take that research route, if in your electives you take major projects and you have a thesis, based on your thesis, how you do it, you will find a job very, very easily.
Okay. So somebody named Mancha has a question here. So how can you work in
Mhm.
Australia as a doctor without clearing AMC? I am confused.
Oh, you cannot. You cannot. You'll go to jail. You cannot. You can give your friends advice. Like my friends sometimes pop up and ask, like, "Hey, dude, this is going on. What can you do about it?" But no, I'm not working here as a medical doctor. I'm working. I have my other side gigs, and I'm working as a volunteer for WHO, online volunteer. So it's a process. What I'm telling you again, guys, if you take the public health route, if you want to go back home, you're going to find really good job opportunities. If you want to go back to India, you're going to find really good health admin. Because if you think about it, what kind of countries need a lot of health promotion?
Countries that are tropical, that have diseases that need to be controlled.
Yeah, right. No, so yeah, so Mancha, sorry if I'm pronouncing the name right. Now you can find a job in public health, then you can apply for MC. So that is what a lot of people do. So they get a public health job. So that could be either a policymaker or a health promotion officer or a project support manager or a research assistant. These are the 5 jobs that are very easily available if you do public health. And then while they do it, then they apply for AMC. And there's a reason for that, 2 very big reasons. Number one, AMC is very expensive. It again, I think it amounts up to 15 to 20,000 AUD, right? And if you fail, you have to give it again. So what people do is that when they finish their public health and they find a public health job, they apply for a PR, they get their PR, and while they have their PR, they start doing their AMC, because that takes a while. It takes a little bit of a while. That is the route. But what I'm trying to do is a different route. I'm trying to build up a rapport with health organizations. And after I build up a rapport with them, I will give my AMC or a PLAB or USMLE from wherever. That wouldn't matter anymore, because I would be working, hopefully, again, this is a hopeful thing. I hopefully will be working for a health organization outside Australia anyway.
Oh,
Right.
how,
So you will find a doctor. Yeah.
how has so this is like a conclusion. Your conclusion is that you can work after public health, but it would not be as a clinical doctor. That's why it is called a
It will not be
non-clinical
as a clinical
specialty.
doctor. Yeah, you will not work as a clinical
So
doctor.
you,
You can, however, work in certain organizations outside Australia,
mm,
because as long as your country is registered as a part of, let's say, UNICEF,
mm.
and then you can work as a doctor for UNICEF, then they're not going to ask you to give any kind of licensing exam. But in Australia, no,
So
no
you
way.
mentioned that COVID has affected your job search, and how has it
Yeah.
affected your job search since COVID? Like the whole situation required more policies, more policymakers, more vaccination
Mhm.
research, and it was like a
They needed more
majorly public
policy.
health centered because there was
Yeah.
no real treatment that we could give. So it was basically a lot of public health issues and a public health approach towards the disease.
So if you take a country like Australia, though Australia might have created issues in certain areas, but they already have a very good public health structure. They don't need new people. They would need frontline workers.
Okay.
So they would not need public. They will need, let's say, some jobs that was really demandable during this time in the health sector was disability workers, nurses. So that becomes more important because the policymakers are policymakers. They have been making policies for ages, and so they wouldn't want. But you can, for example, let's say when it comes to indigenous health, indigenous are the native owners of Australia. So the indigenous population, if you want to work for them in the Northern Territories, then it becomes more easy. But in big cities, it's not easy at all. You know, because they just have to tweak it just a little bit. Yeah.
The next question is, what are some role models that you are looking forward to, or you look forward to in general in medicine or in public health?
Role models for me, like I look up to.
Yes.
Oh God, that is a very interesting. Well, it's gonna sound very snobby, but I'm trying to become a role model. I think in this way because when it comes to doctors, I have a lot of doctors I look up to. Like, luckily, half of my family are people. Everyone's.
You
I
have
mean,
your
half.
own father.
Yeah,
Your
we
own
have.
dad.
I have. Yeah. So it's like my father, my uncles. I have a lot of doctors to look up to, and I think the doctors also inspired me to go to a non-clinical route as a backup if I never want to work as a frontline doctor.
Yeah.
But I don't have any specific role model other than the doctors of my family. Or maybe, oh yeah, I do actually have two of my professor. So one of the professor that I really like was Bernie Murphy. So she's quite experienced in the field of public health, and she's not a doctor at all. It's completely public health. So if you ask me for a public health perspective, I would actually probably talk about Bernie Murphy, our unit chair. She's a machine. Yeah, she worked with health communication mostly with us and project planning. So that was amazing. That was really cool.
I think
Yeah.
I learned more about public health when I came back to India and I started studying for like my licensing exam because Indian curriculum focuses so much on public health than what we did back in school. For us, it was just like a
Yeah.
small unit that we
Aspect.
just
Yeah.
discussed our health policies, and I don't think anybody really researched into their own country's health policies before they even presented them. So,
Yeah, no, without, yeah, that is a very big thing because a lot of the time when it comes to public health, I think back home we do associate it with doctors. Like most of the people with an MPH would be somehow a doctor,
yeah,
unless or until they're the research people, and you wouldn't know about them because that's how they're portrayed.
I think in India, most of the policies have their policymakers like as their name, like their names are there. Like that's what we had to learn at least for our exams, and most of them were doctors. All of them were doctors actually.
Yeah. Yeah. So surprisingly, here that's not the case. If you want to use your public health in the clinical sector, like as I said, with health organizations, or if you want to use your clinical knowledge in public health, it's enhancement over here. I mean, if you have been working as a doctor, let's say with diabetic patients for, let's say 5 years, when you are the same person who makes a policy, you will definitely have a lot of inputs. But at the same time, there will be people, let's say, who has a bachelor's in nutrition or a bachelor's in public health. They would also bring a lot to the table. And maybe that is why it becomes a balance. Because I remember initially when I was working with a lot of, there was a lot of assignments. I was doing a lot of research papers. I was going through a lot of things, and I was writing a lot of like basically an article of some sort, literature review, and so on and so forth. And whenever my professors would initially see it, they would often tell me that, can you not see it from a doctor's point of view? Like, can you come out of that for a second? Because then that becomes a problem. Then it becomes
You become
very,
very
very
streamlined in your thought process.
it becomes very streamlined because you just see the whole process as a doctor. And I think a lot of the people who I was studying with were actually surprisingly doctors. My batch, most of them were doctors or nurses. We had a few nutritionists and health economists over here and there,
You
some
had an
dentists.
IT person.
Huh?
You had an IT person.
No, no, no. The IT person was a friend I met, luckily.
Ah.
Luckily, because Fayaz helped me go through biostatistics, because biostatistics was horrors. I was like, yeah, biostatistics. I did biostatistics 1 and 2. That's how confident I was about the whole situation. I was like,
Because
I
you
got
did
this. I have done
advanced maths in
biostatistics.
CCMU.
And I did biostatistics. I mean, like, no, oh my goodness, the horror of the whole situation. So it's difficult. So again, if somebody wants to come with a public health, be ready to make some changes in the way you think. It will help you, but also come with the right mind. A lot of people will encourage you, oh yeah, go to public health. If you want to come back home, if you want to come back in India, or if you want to go to a country where there is a big need of public health workers, it would help you a lot. But don't come here in the sense that, oh, I'm going to come here, I'm going to keep staying here. Yes, you'll find these $2,000, $3,000 courses, and you're going to do this whole visa thing that years and years and years pass. You're going to just end up wasting time, money, and hope. And I mean, the agents mean well, and some of the agents and immigration lawyers are very successful and helpful, and they are very honest. But they're trying to sell you an idea that worked 12 years ago, 15 years ago.
It doesn't work anymore. So
it not only does it never really worked. It's like, how do I say? You know that friend who?
And you have money to burn, maybe.
Yeah, no, because you know that friend when we have exams, Ashwarya, you know that friend who goes like, no, my exam was really bad, or the other friend who goes like, nah, I don't study for exams, and then both of them are sometimes like the top scorer, and then you're crying in the corner with the lowest possible score. Are you one of those, Ashwarya? Because I can see a little bit of like I think he means me.
No, I always wonder if I'm this person. I don't think so. But I guess other people...
But you know, a lot of people listen to this might know that one friend who goes like, I didn't study, but then they score the highest. Public health, people who go to study public health outside are those people. I'm not saying that agents are lying. It is a good way. It is an easy way to come to the country, and it is a good way because they encourage Australian public health education is really good worldwide. So it is a good way to come in, but the whole staying process, if you're gonna do that for staying in Australia, not working out. If somebody's telling you this, they're lying to you, or they got extremely lucky.
Okay.
You know.
So let's move to the next question. What have you been proud of recently?
What have I been proud of recently? I think I've been very proud of surviving COVID. Because not health-wise, not at least physical health-wise, mental health-wise, because it has been pretty tough on everyone who has been in Australia, especially Melbourne. Mm-hmm. In case you guys do not know, we are experiencing the 5th lockdown. So there was a pretty, I think, no, this is the 4th or 5th. We have lockdowns like every other Tuesday, you know. So I think in April it started, and we had this like big 6-month lockdown, and I still hadn't finished my education. I still had to finish my master's degree, and I had to think about looking for a job. Australia was closed down. Australia was working. Melbourne was closed down, and it still is, by the way. I think from tonight, it's 2:30 a.m. here. So from technically today, the range where we can travel to is 15 kilometers, but we still can't invite people to our house unless or until it's an intimate partner, or you have created a bubble because you live by yourself. So that period of time was very, very difficult. And it is still very difficult, you know, trying to find a stable job, trying to accomplish what I've wanted to do. Because it's a whole process. All of these put together, I think, would be something that I'm very proud of, that I came through this. And I'm actually not just proud of myself, I'm proud of all the friends I have here. I think Paridi is over here too. And then my friends, whoever did public health, because we had it rough. Because a lot of us thought that, oh, okay, public health, which means that it's going to be something that is going to be readily needed over here. We're going to all find work pretty quickly. Yeah, but a lot of us did find work in various areas of public health, but not exactly what would help us progress our career.
It's like you cannot move forward. It's like a pause button has hit on your whole life.
Yeah, and COVID has done that. I mean, and trust me, like the whole idea, but yeah, but that is only true because we are also very stubborn, because we have had this thing that we are going to stay in Melbourne. We're not moving. But if you want to go to regional areas in Australia, you have a very high opportunity to find a public health job. That is also true. So if you guys still do want to come, if you want to do that for the visa route, because again, the agents who tell you this, they're not technically completely lying. It's just that it doesn't apply to everywhere in Australia. So pro tip, if you want a PR in Australia, you have to have a certain amount of points. For people in our sector, we need about 90 to 95 points. That really boosts our chances of getting an invitation for a PR. If you're planning to study a degree, study in regional Australia. It's going to be a pain. It's going to be annoying. You're not going to go out party that much. You'll probably wake up to a snake beside your bed, but you're going to get a juicy plus 15 points added for your PR application that you only get if you study in regional Australia. Even in regional Melbourne, I think you get 10 more points. If you study in a big city, you're not going to get those points. So if you're still willing, if you are planning to take that visa route, please go to the region. It's gonna suck. You're gonna like no offense to anyone, but Australian rednecks, there will be kangaroos, not as cute as you guys think they are.
Punching kind.
And oh no, they're basically they eat kangaroo meat here. That was a cultural shock. Oh yeah. And oh yeah. You guys want to know about that? Is anybody interested in what does kangaroo meat taste like?
Yes, I'm interested in the taste. Like, I'm interested to know how it tastes like. I know that you eat the tail.
It was really weird because the whole time you're eating it, in your head, you're like, I'm eating a giant rat. You know, but it's a bit sweet. But people have told me if you make them into burger, oh wow! Surprisingly, a lot of people started joining when we were talking about eating kangaroos. So kangaroo burgers are apparently good, but I'm trying to keep my halal haram ratio on a good balance. So I need to find out if kangaroos are haram. So if any of my halal buddies know, please let me know.
I'm not even sure. Yeah.
Yeah, it's hard, man. It's eating giant rats.
Some comments. Okay, so let's move on to our next question. Any financial advice that you have learned? Like, so you have been earning more than, like, you've been earning for like a long time. You have been earning since CCMU, and like not small amounts. Like you can.
Yeah, no. The amount becomes pretty small.
Paid for stuff.
I mean, okay, I guess. I mean, I put in those hours. I mean, you have seen me come back dead.
Yeah. Right?
You have seen me come back dead. Financial advice for the young generation. That's a good one. I feel like those uncles, you know, like beta paisa mat diya karo. But I think start saving. That's the first thing. Start saving, because one advantage is that if you guys have, for my people who studied in China, you guys, we're gonna be fine. If you put us anywhere else, I'm not saying China was amazing. We all had good time, as much as some of us would like to say that no, it was fun.
Mm-hmm.
In fact, you might find some other places not as fun, even though there might be better places. But if we have managed to go through China, you would survive anywhere in the world. Work, but your work is readily available if you convert it to Chinese RMB or for Indian rupees or Bangladeshi taka. We will be earning a lot even if you work part time. For example, in Australia, I think the minimum is, if you work legally, it's $18 to $19 is minimum, even if you're washing dishes. But you will also end up spending a lot. So I think it's all about living comfortably is a good thing, but I think also start saving a bit. And one more thing, a lot of people will tell you that, oh, you can come to Australia and then you can work to pay off your tuition. It is possible, but that is going to suck the life out of you. Don't do it.
I think people that have lived outside in CCMU would understand this. Like, it is a possibility. It is a possibility to pay off your tuition, but it's not. Not everybody does it. Not everybody can do it. There are only a handful of people that did it, and they didn't do it consistently. They eventually got to a point where they could pay off.
No, but at the same time, I suggest not to do it because I mean, I sound like one of those uncles. Oh my God, that's what has come to me. My birthday's coming. This is what's happening to me. But no, but it happens that there's a certain age we can. I mean, we were younger. If you come here in your early 20s, go for it. Go nuts. But what happens is that when you hit that 25, you have to start saving. And you have to start socializing and balancing life. So I worked here because I was used to that. I mean, Ashwarya, as you mentioned, that I was working sucks every day. It's horrible. So the thing is that I'm used to working that extra hours.
I have seen you firsthand go out in the morning and come back at 12 and then come chill with us at night. And then party with us and then go back to work again in the morning. So,
but then I got old, dude. I got old. That's what happened. Now I want belly buy. Sometimes. No, there are days I'm awake till 4. I slept for 3 hours. I wake up. I still do a bit of teaching, by the way. So I wake up, I take those classes, and then, or I go to work. I was working at a Japanese restaurant for a bit, and that was fun. It was all good. But then as you go there, you start hitting those days when you're like, wait a second, why am I so sleepy at 10 o'clock? Like, what is this? What is this new feeling?
This is what I imagine. Like, this is what my vision of your life is, that you would be a teacher. Because I think that you have been a teacher for so long and then you're a good teacher. This is how I see it. This is why I think public health would be like great.
It's good for me. No, if I get into health administration, or if I have a lot of options available for me, I'm just trying to, because, I still have a little bit of time. So I'm trying to use that to find the most ideal job for me, because again, I do want to be a doctor. That has never left my thing. And whenever I suggest any one of my friends to take that extra dose of paracetamol, it works out really well. So I don't have that hasn't gone yet, but my experience in public health, learning public health, working as a teacher to children who don't speak the language I'm speaking with them, with the fact that I do want to work and I spent 6 years, I want to just combine all that together to find the most ideal job. I can always be a professor in hopefully, like I might have to do possibly a PhD. Anyway, the point is that I can always be a professor in public health or as a doctor, because again, if you combine these two subjects and if you play it right, it works wonders. It is not a requirement. One is not the requirement for the other, but it does make it better.
I was just counting how many
years
like when we all after undergraduation, and then I was counting Like how many more years you want to study with your PhD? Maybe 3, 4.
Oh wait, that's fine, dude. Look, we're doctors. It doesn't matter.
Yeah.
You're doctors. You finish your degree, then you go do your licensing exam, then you work this, you work that, and poof, you're 35. It doesn't matter. It doesn't matter whichever route we take.
Yes.
I'm
We are all
scaring everybody, huh?
35.
Anybody's Yeah, I mean, technically, yeah, the next thing you know, you're 35. But yeah, it's good though. I mean, again, it's a good experience. Something really funny. Okay, when I was thinking about this whole thing working out, it's like remember when we all switched from electric bikes to petrol bikes, even though it was like super illegal. It was kind of like that, you know. I mean, we could still do with the electric bikes.
Yeah, but
Public health is a lot better, Israr, if you, sorry, Shreya. Public health is a lot better, Israr, if you are working in our countries, in countries where the public health sector really needs to be whipped up. If you come to a country like Australia, maybe America, it's a bit more, but if you come to a country like Australia and you're in a big city, the big city already has such a pristine, immaculate public health like structure. You will not find work. You will not find work. It is about availability too, right? Because if somebody is leaving a workplace in a city like Melbourne, they need somebody with at least half that experience to get in.
okay.
So public health work is a lot better if you get the right job. But if you if you join like for the research, let's say if you do, you should see my friend. Oh, she was so anyone in research just no, no. But you can find easily good jobs with research, very easy.
So this person
Comparatively.
asked if he can join in. Can you like wait 10 minutes? Let me finish these questions and then I think people can join in if they want. So
Yeah,
the next question is, do you believe like certain types of people are best suited for certain specialities?
without any doubt. Without any doubt. I'll ask you this, Ashwarya, because this is something that I want to work with. If I go complete doctor route, this is what I will do. So I'm going to ask you, what do you think about kids?
I don't
Do you
like,
like children?
no.
And now let's say you become a pediatrician.
I'll not kill them, but I
Are
don't
you are
particularly like them.
Yeah, but how will you be able to
Yeah,
have you
it's
seen pediatricians? Oh my God. We've seen them work. You see how patient you have to be. Or
yeah.
let's say forget like an age group, focus on the age group. Let's say you become a cardiologist, right? Are you good with numbers? Are you good at reading ECGs?
Yeah.
All of these does affect, right? And I know that in the medical world there is this whole hierarchy of medicine, like you know you have GP and then it goes up, and then in neuro whatever becomes the top of the list.
So
You don't have to aim for that.
I
You
have,
don't have to aim for that. I mean, yeah,
yeah.
of course,
No, I think this
if you go there,
hierarchy
you'll.
is like complete BS because a few days ago, one like VIP patient came in and he wanted my surgeon to give advice over esophageal ulcers, and the surgeon just got in the intensivist because he knew that he didn't have the answer for his problem. People don't realize how, like,
Yeah,
just because you're a surgeon or just because you believe that the hierarchy exists and a surgeon is a better doctor doesn't mean that he can treat everything and he knows everything. But
yeah,
I
true,
agree with
true.
you on this point that I definitely think that you should have a certain personality or you should have a certain aspect to yourself, and only then
Hmm.
certain or
An interest, a curiosity and interest. If you go with the wish for money will only take you so far, you know, and that's the thing. Um,
okay, let's. So, do you think gender has a role in what you choose to study and specialize in, as and has gender affected you personally in like your country,
personally,
your
mm, personally, no. But if you talk about our country, who has so much to talk about? Like the idea of male nurses, or the idea of a male gynecologist, or the whole idea of a female doctor in a high position. in a medical career is somehow still such a big issue. I mean, I'm not saying it's a gender issue. I think it's just the perception of certain doctors should be certain doctors. I think in medicine, it's like that. In medicine, I think it has never, at least in my experience, I'm a guy, and unfortunately, I drew the safer card in the thing. I mean, to be very honest, and people do not judge me as much as they would judge a woman in my same position as me. But with the medical career, I think back home, I think it has already been pre-decided that a certain doctor should have a certain gender.
Yes.
Or a certain medical worker should have a certain gender. However, this is definitely not always the case over here. I've seen plenty of male nurses. I have seen male gynecologists. They do ask that, okay, would you prefer a male nurse or a female nurse because of your, let's say, whatever, your religion or culture or just your personal choices. But I think overall here, it's not a big issue.
Okay.
It's not a big issue, but I think back home people should also start changing that mindset.
So let me ask you sort of like the last concluding question, and then we can see if Goof Empire wants to join in. So this question is basically like a combination of questions. Since we are just answering everything in one question, how has you, like living in China, studying in China, working there, how has that affected you? How do you see yourself? Like, how are you different than the people that you're studying with, or any doctors that are graduated from their own country and are studying with you?
Cool. Oh, we are machines. I told you this already. Don't worry. You go anywhere in the world, you pick us up and you throw us in the Sahara Desert, we will be fine. And we'll also find a job there. So people who have studied in China with me, congratulations, guys. We're fine. We spent 6 years in a completely different country, getting along with their culture, getting along with the people. A lot of people who had just started over here, because I see people experiencing things that I experienced when I was 17, when I entered China. You know, the drama, or, oh no, I cannot eat the food. I have a very good friend. She's one of my most dear friends over here. And I remember when we initially met, she's vegetarian. And then I remember this is a very ingrained memory, is that we walked and then I got her a ricotta pie and she's like, oh, this doesn't taste good. And I still have friends who cannot eat non-brown food.
Oh, yeah.
But we, look at us. Oh, we have enjoyed, like, we had eaten different kinds of food. We have lived in different kind of places. That independence of being away from, it's never easy. It's never easy being away from family. It's never easy being away from friends. I miss you guys a lot, all of you, including Israr. Like,
no, don't believe him. He doesn't miss me at all.
but the whole idea that, oh yeah, I'm leaving home to a country and everything, it's difficult for anybody who's new. Simply put, if this was a video game, we have already played the hard difficulty. You know, where everybody else is starting.
Okay.
Yeah.
So, hi, Dr. Israr.
Hey.
I just know that you graduated from CCMU, and I don't know what your journey has been. Could you tell us a little bit about what you're studying?
Right now I'm working in Pakistan, in Peshawar, in like one of the biggest hospitals in HMC. It's like Hyderabad Medical Complex, and I'm like a fellowship resident actually now in anesthesiology.
Oh wow!
Yeah, so like I ended up becoming an anesthesiologist. Like, okay, I hate when my patients can speak, so like I just shove a tube down their throat and they can't speak now. And
see,
like
personality with what specialization.
That's the question. Yeah,
you
like,
got that answer.
Exactly. So you got that answer. Like, I hate kids, and I hate working in OPDs and working with patients. So like, might as well just join anesthesiology. And it's like a tough field to get into, but
yeah, it's very difficult to get into, and it's also
It's actually a very
Maybe.
difficult field to study
Mm.
and major in. Like it's a 4-year training, and I'm like literally on the second year of it, and I'm just like exhausted every single day.
Because, like, I have seen this, like, most of the people believe that surgeons do all the work, but whenever I call up a surgeon to tell them that their patient's there, and they're just like clear it with the anesthesiologist. And if they have like any doubts, they just don't take any risk. They're like, just talk to the anesthesiologist.
Oh
That's
no,
because it's
here the surgeons
yeah.
fight you. Yeah, here the surgeons fight you. They're like, no, I'm right, you're wrong. You're gonna put this patient under no matter what. And we're like, nope, it ain't happening.
So
And if you want to avoid all of that, public health,
yeah, so he
Actually,
wanted
yeah,
to
if you want to
like
where
avoid
you
all of
go
that,
home,
no, but
sit on your computer.
public health has a lot more drama compared to like what we do. What
No,
we
no,
do
no.
is like we only have to deal with surgeons. You have to deal with the whole hospital.
Yeah, no, no. If you work in health administration, right? So yeah, that Israr has a very good point. So whenever we think about public health, it often leads to the health administration role.
Yeah, exactly. It often
That is
leads
not
to,
always.
yeah, because you
Yeah,
often
that is.
end up like leading a hospital.
yeah.
Yeah, yeah, that is a very big position and a common position. So that is only one option available for you, to be very honest. You can always be a straight up policymaker. Maybe back home it would be easier if you're a doctor and you have public health. Again, if you plan to go back, wonderful choice. But if you maybe look at other options, because health administration would be a completely different career, by the way. That's health administration. That's a
Yeah,
different
but
course.
exactly. But
Yeah.
anyone that does
Yeah.
masters in public health ends up leading a hospital anyway, so
Yeah, I know that's I mean that's my backup future.
that's your backup. You always have a backup.
That's
Always
my
keep a
backup.
backup with you.
That's my backup. Yeah, that's my backup. Uh, Either that or buying a farm in Australia and like raising sheep. You know, that's my.
No, that's you raise sheep in New Zealand. They're sheep shaggers.
No. Australia has like sheep too. There's a place called Gippsland. I have plants. I have backup. So you come with our backup. Yeah.
Cool, cool. I
How's
don't have a
public
backup
health?
plan, so I have to get through this.
How's public health in Pakistan? Is it like similar to what we described?
Um, I didn't really get to the part where you talked about.
So he basically told us that
Health, like let's say.
oh, he
Like,
basically told us that there's like a
public
lot of
health here, there's no
research.
concept.
Go ahead, go ahead.
Like, there's no concept of public health in here. Yeah, there's no concept of public health here. It's just like each individual hospitals decides its own little version of what you're supposed to do, and they follow that.
Oh.
And every hospital is now privatized. There's no government hospital, and then you've got like public health insurance. So like every hospital does whatever they want.
But then there must be
Oh
policies.
wow.
Like I know that Pakistan still has polio, right? It's like one of the few two like 5 countries left that still has it. So you must have policymakers and stuff. So that's only like a government job then. It's not
Yeah,
directly
that's the only,
associated.
yeah, like that's the only like government job, and there are ministries specifically made for that. There's like NDMA, National Disaster Management, and they handle all of they're handling the pandemic, they're handling any transmissible diseases that happen, anything like that.
No, we didn't even
But
cover disaster management. I think that even that comes under public health, right?
Public health,
uh,
yeah. But then
yeah,
that would be
even
a
COVID
government job.
management. Yeah,
Full government job.
that's like a full
It'll be a
government,
full
federal.
government
That's a
job. So
federal thing.
if you're a student over here, unless or until you have a permanent residency, you will not be able to apply for the jobs.
Yeah,
That is a very important thing. So yeah.
yeah, that's actually important. And
Do you
also
want me
like
to talk about it?
Maybe. Like you remember we were going to do it for 20 minutes. It's already 1 hour. But like if it's
Oh
interesting,
no,
I
that's
am
fine. That's fine.
also
We can end any time. I mean,
no, no,
no,
no.
I mean that. that again, remember when I kept on telling you guys that if you want to go back home, you have really great opportunities. This is the exact reason, because back home you're a citizen of the country and you'll be able to join a government organization, right? It's either that or NGOs. Over here, you will not be able to join any government organization. So I did not even bring up that topic. So if you want to do plannings and if you want to show how the government policies, basically, you must be a citizen. So if you plan to work something like that in Australia, get public health degree here, go back home, work, and then come back. Apply for a PR and then work here. Because if you have work experience, then they'll give you a PR. Then you can work in the government organizations. I think I hope I was helpful. And
I think personally it was very helpful, but I still don't understand what exactly your work profile is. Like, what is the work that you bring home? But then I guess this
okay. So no. So quick 5 things. Yeah. Okay, five aspects. So the first one is an epidemiologist. Yeah. So you collect data of diseases and then you present the data. That is your job. You can be a qualitative or quantitative. Qualitative, you have conversations. Quantitative, you collect data. Or you can be a policymaker. So you give your input, whatever data is collected by the epidemiologist, they are biostatisticians, they will send it to you, you look at the data, you create policies, you present the policies. Then you have health promotion officers. So you have those policies, your job is to go and spread it to the people and convince them to follow it. Follow the rules. So basically the health police. Then you have health administration, which is you work in the hospital, you make with Isra talked about, right? And then you have disaster management and humanitarian aid. Okay. So in humanitarian aid and disaster management, if you do have a medical degree, it helps, plus with public health. So disaster management would be only in these kind of situations. Let's say there's a forest fire, there's a flood. How do you deal with the situation? So you become an epidemiologist and you become a health promoter at the same time, because you have to make quick policies. So these are basically, and humanitarian aid is you join an NGO and whatever, all these policies, all of these things, you are basically the worker in the field. So public health entails data collection to working in the field. And there are all those 3 jobs in the middle. I want to be the last one in the field.
Okay,
so which is the most difficult?
Would you like to say anything to conclude today's talk? And maybe I can ask Dr. Isra to join us for the anesthesiology session whenever we do it in the future.
Oh yeah, Isra would really love talking about putting people under medicine. Yeah, Isra. You go, you boo. Tell people how you drug people.
No, like it's not really that difficult. Like people make it out to be really hard, but once you get used to it, it's not really that hard. And the job is actually really stressful. You're just staring at the monitor the whole time. The patient's BP goes up, yours goes up. Patient's heart rate goes up, your heart rate goes up. It's like literally you're in sync with the patient. Like if there's an emergency, you're the only thing between the patient's life and death. So you're the only person responsible for keeping the patient alive.
Yeah, I've seen some random things because like I have to deal with a lot of anesthesiologists, so I know that they deal with a lot of crap from surgeons.
Yeah,
so if you want to avoid all of that, public health.
No, but what I love about it is the local anesthetic blocks that we have now for like hand surgeries, for lower limb surgeries, for gynecological surgeries, even hip replacement. They can be done under local anesthetics now. We give nerve blocks, different kinds of nerve blocks for different surgeries. That, for example, you've got like a broken finger, and you need to like surgically fixate it. So you just give them a wrist block. It'll just like drop the person's hand, like it'll just be hanging, and
so
you won't feel anything.
Block, not like an entire brachial block, right?
No, it's just a wrist block, like the median nerve, the radial nerve, the ulnar nerve. You block it at the wrist. And for the whole arm surgery, you just go like supraclavicular brachial plexus block, and that would just numb the whole arm, and you can just work on the arm. The patient's awake, he's talking to you, like there's a screen between the patient and the arm that the surgery is happening on, and you just chat with the patient, distract them.
Fun stuff.
Yeah, but like
Yeah, fun stuff, guys.
Yeah.
some surgeries, like laparoscopic surgeries, you have to do them under GA
Yeah.
because there's no nerve block that'll block that big of an area. So yeah.
There are laparoscopies done in spinal blocks though?
No, laparoscopic surgeries, they involve like filling the abdomen with carbon dioxide. You fill it up with CO2. That puts a lot of pressure on the diaphragm. So the patient's own breathing can't keep up with the amount of pressure you're putting through. So you have to put the patient under, you have to relax the patient and put him on a ventilator. Yeah.
Damn. All I heard from that is like, oh God, that's like 3 ethical violations. Public health. That's 3 ethical violations right there, you know?
But what I hate about it is like whenever they can't intubate a COVID patient, they have to call you. So
yeah, I think now
you get called in, you run and just
get intubate COVID patients.
Yeah.
But then I don't know. Oh, the most difficult intubations I have seen since I work in a cancer hospital are like we have a lot of buccal mucosa patients, and they have like not even 1 finger mouth opening. So it's always like malampatti, like 3 or 4.
Malampathy 4 scores. Yeah. But with those, there we have what do you call them? Bronchoscopes. They're really thin fiber optic scopes. We just go in with the bronchoscope while the patient is awake. And we like tell them you have to stay calm, and then we just intubate them through the bronchoscope.
I don't know. I asked my patient to stay calm today for like a Riles tube insertion, and she vomited all over. Like,
well, you have to keep them NBM.
Yeah.
8 hours NBM. So.
Oh no! Like I was just preparing her for surgery. I don't like.
Oh.
So I had to do like a gastric lavage, and then she just did it naturally, vomiting. Okay.
Like, see, now Sohan doesn't have to deal with this.
Yeah.
Yeah, no, that's what I was thinking. I was like, damn.
I think this is like the clinical part is something that I understand now since I'm working, but the public health part is like, okay, I understand what he does because I've studied it, but it's still kind of alien since I have not worked in public health. And it will be so much fun to, you know, get a like just a small a month or 2 of
because it's really interesting, especially when you're working in a team, because public health would be always working in a team. Whether even if you do research, it's a big factor of it is teamwork. And also you have to be very good at communicating with people, because you have to convey data from the stakeholders to the middlemen to the to the community, right? And it's a different kind of responsibility.
Something
I'm really bad with communicating with people. So
something that I've observed is that maybe you and me, we have like different beliefs, but in India especially, and like in our South Asian countries, let's just say, because this Pakistan, Bangladesh and India, so in like South Asia, people have like especially rural areas can have certain mindsets, and you explaining certain health policies like contraception to them is very difficult. And I've seen some public health policies reaching out like in a really good way. And I sometimes when I read these policies, I feel like, wow, this person has put all
you have to really think. Yeah, you have to, because you cannot when I was doing this qualitative research, I was talking to this Prabhuk from Adra he works in Sri Lanka, and then I remember him talking about how a different religion different communities. You cannot go one way. You cannot have this one overall policy, especially when you go to our countries, because we have different communities, different, and you have to make sure you cannot just be like, yeah, don't care about their religion or don't care about their feelings. You have to think a lot. So but the good news is that the public health courses do prepare you for.
Yeah, another factor that South Asian countries have separately is, I think, financial. I don't think people outside think a lot about finance, but like even if I have to prescribe like a single medicine or test to my patient, I always think about, oh, will this patient be able to pay going forward? Will this be like a financial burden since they're like just
Exactly. Like
daily
sometimes we even
workers?
have to, sorry, I'm cutting you off, but sometimes we even have to get like medicine out of pocket for the patient while the patient is under, because they're way too poor to afford it. So like we just give the money to someone, hey, like, hey, go buy this drug so we can go save their life or something like that. And we've done it for countless patients.
Yeah,
Whenever they're too poor to afford a drug, we just pay someone to get it for us, and they get it for us, and we just give it to the patient to save their life. Like sometimes we don't even have adrenaline.
So, these things, I think we as clinicians deal with it individually, whereas public health people have to think about like a whole community where they cannot put everything from their pocket and they have to basically finance everything that
Yeah, we can
needs for
hide
them.
and we can just pretend like we don't care, and then you don't know who we are.
Oh,
Like Batman.
in India, you get money to get vasectomies done. Like the person who
Okay.
kind of suggested. So if I was to go and tell a man that you can get a vasectomy, the man will get paid, I will get paid, and the healthcare worker who has taught me will get paid. So these things are happening. Or somebody who's distributing contraceptive gets paid. Or malaria, like people that are like spraying for malaria and stuff. It's
Yeah.
like really good. Like whenever I read
So
about
yeah.
public health in India, I was like so intrigued. I'm like, wow, South Asian countries have like really intelligent people dealing
No,
with
it's really fun. It's really fun, and I also suggest that whether you want to work as an epidemiologist or a health project officer or a health promotion officer, I strongly suggest that if you are looking at it at a professional point of view, do work back home. The experience you will get, you will be able to apply it much better. If you want to move away to a different country, leave it for later.
I
Graduate,
would
finish a
suggest this
public health
even for
degree.
clinicals though. Even for clinicals, I've observed that maybe I want to stay back for a few years and learn things.
No, but the thing with clinicals is that regardless of, I mean, of course, the volume of patients will be a lot in our countries, but regardless of where you go, you will always get a steady amount of patients. With the public health sector, for a person who is newly into the thing, the basic issues you will not find in a first world country.
Yeah, true.
Or in the major cities of the first world country. I'm not saying that the first world countries are perfect. There are places in Australia, there are places in the States which are pretty messed up, and they do need people. But what happens there is that when you decide to work in a situation like that, you have to learn new things, and also you have to adapt. That becomes a very big issue for a lot of people. If you do have good adaptive qualities, go ahead, but sometimes it's not really worth it. So especially for the public health sector, if you want to work directly in public, not like what I want to do is that frontline worker as a doctor with public health knowledge, so that I can have my inputs, and then I understand the policies given to me. I'm not just doing it out of thing, right? Either I will do that, or my second backup is health administration. A listener, until you want to do those two, really, you will get a lot of experience working at home. And in fact, most of the professors I have worked with, most of the people over here who are in high places in the public health sector, worked in countries like ours when they were younger.
Yeah, I agree
None of
with
them
that.
had.
actually. I do agree with that. Like,
Most of them.
like I'm doing anesthesiology specifically here because it grants me an exemption from PLAB. Like I could go to the UK once I'm done with my fellowship. I could directly go to the UK and be a registrar there in any hospital in a consultant position. And the experience that I gain here, I won't gain anywhere else. Like working with limited capacity, limited resources that I'm
Hmm.
provided with, and the situations that we're put in with patients that, oh shit, this is an emergency, you have to do it, but you have only like these drugs to do it with. So that
Yeah,
experience cannot be gained anywhere else, anywhere outside South Asia,
true.
actually,
Especially,
because
especially for
exactly,
GPs, that applies a lot because over here, a lot of people complain about the GPs not doing the right thing. I had a friend who had a back injury. She broke her tailbone, coccyx. She had a little hairline fracture. Oh, I still remember doctor terms. So she had a little hairline fracture. So when she came to me, the first thing I said that go do an X-ray because she said I have a back pain and she couldn't explain why she had that pain. So I said go do an X-ray. Right? She went to a GP over here. The GP said no, you don't need it. And you know how we laugh back home, like we joke
yeah,
about the GPs that oh whatever happens, do an X-ray, do an X-ray. That policy is so important. You have no idea because sometimes
it
people here
is.
don't do that. And my friend, she realized she had that hairline fracture after the fracture fixed itself. And her coccyx, unfortunately, did not align right because she did not do the whole procedure. We didn't know. Everybody thought it was a muscle pain. So a lot of people have told me here that GPs, which come from other countries, whether they're from a South Asian or an Asian country, they tend to sometimes be better. I'm not saying that GPs here are not good. There are people with a lot of experience who do really well, but that experience factor does work a lot when you work in a country like ours. But if you're specializing, to be very honest, it isn't a big issue where you do it for. That's what I can see from the situation in Australia. If you're a specialized doctor, you're always busy. Like if, for example, if you want to go to
Yeah,
a specialized doctor here through the Medicare, the government route, it can take you up to a week or two to get
yeah.
to
Like
see that doctor.
we have a similar thing here. It's called they call it Sehat card. So it's basically like that government provided healthcare insurance, right? But to get to a specialist or a surgeon or like okay, for example, a spine surgeon, to get through to a spine surgeon and get his time, it could take up to 2 to 3 months. So
Oh,
it
Yeah.
could take a long time.
So
it's
it,
not
that
like
that
that in India. I think
that
people
aspect
judge
is
directly.
exactly.
People just kind of assume what their issue is and they'll just go to a specialist. It does
Yeah,
not
they
take that
assume,
long.
Yeah. So
but
yeah, you
here
cannot
you
over
cannot do
here.
that
You
here.
cannot go to a specialist without a doctor's GP's opinion because
Like
you filter
here
that out.
here you show up in the ER, the ER doctor sees you, then
Mm.
tries to treat you. If he cannot or if it's out of his scope, he will refer you to a specialist. Like
Does
first you
it?
get treatment from a GP or an ER doctor, and then you get referred to a specialist later if you can't be treated or if he diagnoses you as something that a specialty has to handle.
Oh, I have like
So
a
you can't go to
question.
a specialist directly.
Uh, like a few years ago, I knew that Pakistan didn't have like a liver transplant center. Does it have one now?
We have a liver transplant institute, but the waiting list is so big, and it's just like one institute for
Oh,
the whole country, like 200 million
oh,
people. So, like, imagine the waiting times for people. Like, people can't really wait that long.
that's true.
So
That
that's why
doesn't.
they usually go to either India or Turkey or somewhere else to get a transplant.
Okay. Okay, guys, thank you
Mm,
so
Turkey.
much. Should I conclude it, or do you guys have any concluding notes
Oh,
before
I'm
we
completely
close?
fine. I hope did I manage to answer the questions right?
Yes, I
Uh,
think like most of the questions that I had and I got were answered. It was fun.
right. That's the most important part. So yeah, thank you so much, whoever came in to listen to me rabble, and
Well,
then
I'm probably
thank
the
you,
only one
Israr,
who
for
like listened for long enough and joined in as well. So
Yeah, no, no. There were people. There were people. We have some people who came in to
Yeah, they
see
were
if I'm
coming and
still
going.
alive.
Like,
Yeah, they're like, oh,
yeah,
this
like
guy's still there.
you don't even
Yeah,
reply to
I'm
messages
not.
anymore. So
I'm really off social media, to be very honest, because over here, it gets pretty busy. Pretty busy if
mm,
you're trying to balance three
no,
things.
like
You know, because
exactly. It actually does get busy, even if like any job you're doing. Like I got back home like
yeah, it
three
gets
hours
really
ago,
busy. Yeah.
and I have to get back to
Mhm.
work at 8 a.m. and then come back at 8 p.m. again tomorrow. So it does get busy.
Wow.
I got
Yeah.
back 1 hour
Yeah. So
before
it's
the
really
live.
messed up.
I know I got about 30 minutes before the live, but I have like a night shift tomorrow. It's okay.
Oh, well, I have a day shift tomorrow,
Uh,
like 8 a.m. to
adulthood,
8 p.m.
adulthood,
8
guys.
to
Congratulations. We have come to. We're in a good
Hey,
place,
the
I
money is good,
guess.
so
Yeah, I can
Yeah, the
understand.
money's good.
I kind of am enjoying my job right
Yeah.
now. Okay.
yeah,
Oh no,
like
Yeah,
even
I'm
I
very
enjoy it
happy with what I.
hopefully we can do this again someday, like soon.
someday, yeah,
Yeah.
soon.
Okay.
Possibly I
When I
have
when
like
I
this
run my
media
own.
thing coming up, and I might ask as well because it will be fun.
All right, all right,
Okay, see you guys.
Yeah.
Bye.
all right. Bye.
Sarah, thank you. Bye bye.